This video is a little longer than my usual ones, but I think it's important, so please bear with me. The main point of this is to show you some improvements to the Continue from Ambulatory feature that will be coming on March 11th of this year. In the past, there have been some frustrations with having non-formulary medications being difficult to replace. This has an improvement to that. And there have also been issues in the past with medications at home that you want to continue in the hospital, but maybe you want to make some changes to the dose because their clinical condition has changed. The improvements address both of those things. Before I get to those, I want to pause and talk a little bit about the home medication list in general. The management of medications across transitions of care from outpatient to inpatient back out again is a big focus this year. And discharge medication reconciliation is going to be a big focus later this year. This is an opportunity to pause a little bit and think about it on the front end of that, coming in from medications from pre-admission testing or obtained in the emergency department or on admission. This is the ideal output of that process, the home medication list. And you can see that here it includes medications, but it also includes some other information, some metadata about the medications. And you can see in here the name and the date and the time that somebody last touched this medication. That is of some help as you try to assess, if you're trying hard, to determine the accuracy of these home medications. This column is even more helpful, though, if it's filled out. So the fact that this person touched these parameters and said that the patient last took this pill on this date and this time gives me, as a different clinician making decisions about this patient's home medicines, a pretty high degree of confidence that that's an accurate medicine. Seeing, on the other hand, something here that says unknown dose, well, maybe they were taking 500 milligrams, maybe not, but there's some assertion here that we're not totally confident in the accuracy of this medication. Here's some others where we do have a high degree of confidence. And I do want to point out that the hospital this year is changing the roles and functions of pharmacists and nurses and physicians as well in the hospital to try to make this home medication list a more believable entity. And as part of that is increasing use of this sort of warning icon here. This means attention is required to this medication. It's obvious if you look in the guts of it, because you can see it's some unspecified pain pill. But this kind of helps you be aware that some more attention is required. If this were being used properly in this case, I'm doing this to make a point, really this medication should have a similar flag. I'm just going to show you how that's done. Not that all doctors are going to be doing this, but this is the screen where the person who obtains or updates or modifies the home medication list can go in and include all sorts of other information. So for instance, it's possible to say that the information source on this is the patient's daughter, but we still don't have all the information we need, and some attention is required before we really believe this is a home medication. So that's all just kind of background information, but I want to show you some of the newer features. So that's here under the Action button. Let me pause for just a second and say that some docs who've been doing this for a while do Continue from Ambulatory by going here into the Orders section and using this button. Because of this metadata, I'm going to suggest that using the Action button and do Continue from Ambulatory here. As I do this, I want to recall that the Cipro had some issues with it, and the pain pill obviously had some issues. Now this is going to tee up all those medications in a new format, and this is where the good part comes. So you can see that it assumes that we want to continue these medications, but it gives you the options to edit them, to replace that medication with a different medication, or hold it. So we'll come back to that in just a second. You can see that these are medications not on the hospital formulary. The option that's appealing here is this Replace by Pharmacy option. So this allows the user to say, oh, pharmacist, you figure out what's on the inpatient pharmacy and take care of it, and they will do that. Or to say, well, I know that I want to make some modification, and the provider can do that. You can also hold that, still have that show up in the list, but have no attempt to administer the non-formulary medication or a substitute. So here we go. Let's go through the list here. Well, all right, well, we'll continue their aspirin. The Cipro, I recall that there was a problem with that. I'm going to actually undo that so that no action is taken with this Cipro. And then the Lantus was 25 units, but typically I'll reduce patients' long-acting insulin a little bit when they're in the hospital. So I'm going to edit that one. Ideally, by clicking Edit, it would present you with the order string so you can go ahead and modify the 25 downward at the moment, but you can't. You have to kind of work through this screen, and then it'll show you the things you have to attend to. And the metoprolol, well, yeah, we'll continue that. Let's go down here to the medications not on the hospital formulary. Well, so this is Aspart insulin, Novolog. I happen to know that Humalog is the inpatient thing, but rather than have me replace this, I'm just going to let pharmacy do it. And here's a combination pill. The pharmacy doesn't stock combination pills for the most part, so lisinopril and HCTZ. So I could let pharmacy replace that. Or if I'm a neurotic internist, I may want to replace this with just the lisinopril and not give the hydrochlorothiazide, because hypokalemia is a rampant issue in the hospital sometimes. So maybe I just want to give the ACE inhibitor. And then this pain pill here, well, I'm going to be prescribing the medication, the patient other pain medication, so I'm not going to mess with this right now. I'm going to undo that one. So now let's click OK. Now it's going to present me with all the actions I have to take on those individual medications. This is that thing saying, well, it's going to be a long time before tomorrow morning. Are you sure you want the patient to go without aspirin? Well, I want them to get their aspirin today. And this is where I wanted to change the dose of that Lantus from 25 to some other dose. I'm going to reduce it to 15. And now I'm replacing this lisinopril hydrochlorothiazide. So again, sometimes it's a little confusing as to what screen is presented here, but this is the key information you need here in the smallest font. So I'm just gonna, all I want to do is give the lisinopril. And it's saying, again, do you want to wait till tomorrow? That's fine for this case. Here is a creatinine clearance check. I hadn't realized that this is a patient with renal failure. Well, I'm going to actually comply with this suggestion and not give lisinopril to this patient with a low creatinine clearance. So there you have it. But the main point of all of this is that with using those screens, I've chosen to continue aspirin, to continue the Lantus. I did make a change to the dose of it. I'm converting this, letting the pharmacy convert this Novolog to Humalog. I have not made any action with this Zesteretic, and the metoprolol I'm continuing. So the next step is just to save this. This will file those changes and continue those medications with those modifications that we talked about. Thanks.